What are some factors that enhance or block patient empowerment?
I really think patient empowerment is tied to knowledge and having the knowledge to empower yourself, or having barriers to knowledge being that patients don't have the knowledge to know what to ask for or how to ask for it. Things that block that, or nobody taking the time to educate them, or not educating them in a way that is right for them. So not having like a needs assessment or a learning tool that lets you know that you're educating them in a manner that they understand. But I think patient empowerment really comes down to giving them the knowledge they need to know what to ask for.
Okay, the second question is, what is patient empowerment and what is the role nurses have in patient empowerment?
Nurses have a key role in patient empowerment because I feel like nurses are driven by patient education. I think anytime we interact with a patient, that's an educatable moment where we have the right and the privilege to educate them on something to do with their health care and to find them the services they need. So as a nurse, our job is to educate patients on anything. If it's the medication we're giving them or the assessment that we're doing to them, like what are we looking for, what are we listening for, especially related to their disease process, because that will help them manage it in the future. Even if it's something you think that, or that you've told them 5,000 times, you just try and tell it in a different way each time, and hopefully one of those ways will click with the patient.
Can you describe the role of diversity in empowerment?
Diversity. Also, I think empowerment comes back to education and making sure your patient has the information they need. So when you factor in diversity, you're looking at ways culturally or maybe religiously or ways that they've kind of lived their life, or ways that are understandable to them that fit into their culture, and making sure that they have education they need to fit their culture or diversity or region to make it understandable for them, and something that maybe they'll follow through with. There's lots of different maybe religious beliefs or things that they will or won't do based on religion. So telling somebody to do something against their religion, you're not empowering them. They're probably pushing them away from healthcare instead of like bringing them to it. So trying to work with your patient to find something that works for them within their ethnic background or their culture or their religion.
How do you promote nurse empowerment while working?
Nurse empowerment?
Yes.
So as nurses, I feel like we have a wonderful role, and to be confident and to know what our role is and how to communicate that to our patients. So empowerment for patients and for nurses, I think, is also based on knowledge. So being confident in your skills, in your specialty, and knowing why and what you're doing and why and what you're looking for. So providing nurses the education so that they understand that will also then empower patients, because they will pass that knowledge on to the patients. So it's kind of like a cyclical cycle. You empower the nurse to empower the patient, and then I think our healthcare will kind of change, and we'll see patients better knowing about their disease processes and being healthier because they're making better decisions because they'll be empowered and knowledgeable.
And the last question is, how do patient empowerment and autonomy work together?
Well, same for nursing empowerment and autonomy. When you know what you're doing, you have confidence in your skills, and you don't need anybody to tell you what you're doing because you already know it, and you know why you know it, and you're knowledgeable in that aspect. So rather than having somebody say, oh, that patient's going to need so-and-so, you're already anticipating that they're going to need that because you're knowledgeable in that area.